Hi, my name is Lynn Kuhn, and I'm a licensed professional counselor in Portland, Oregon. I wanted to talk today about what therapy isn't, and I'm hoping by talking about what it isn't, you'll understand what it is. I think the media portrays therapy as something that it's really not, and I think it's important to clarify what it is and what it isn't. So the first thing is that therapy is not necessarily something that lasts for years. That's really dependent on the issue that the person comes in with, the needs of that person, and the opinions of the therapist. So it's kind of decided between the two of you, and it's based on what your needs are. So therapy is, at least for my clients, is generally short term. Um, it might be a couple months, it might be a couple weeks. It depends on what the person or the issue is they're working on. Now, that doesn't mean that as time goes on, the person doesn't come back with a different issue. And so it can be something that you come in and out of depending on what your needs are. The second thing is therapy is not confrontational. That might be some therapist style, but because that's the therapist style, it also has to work for the client. I challenge, I point out discrepancies. Um, I ask questions about maybe why we're coming back to a topic again and again, and how come it's difficult to do something different. But it's generally not confrontational like you might see on television. Um, and it has to fit your style. If really confrontational is what you're looking for, then you might be comfortable with a therapist that is more confrontational. But generally, that's not just how all therapy is. Therapy is not about giving advice. I ask questions, I summarize, but I don't generally tell someone, rarely give someone advice. I encourage people to make their own decisions, to weigh the pros and cons, to figure out what's right for them. But I'm not driving the car. I'm the passenger, and I'm helping guide. And the last thing is that therapy doesn't have to dwell on the past. The past can inform what people do in the present, but it doesn't have to be something that a therapist spends weeks, months, and years looking at. I generally might spend a session or two looking at it because I think that it's important. It can frame how people view the world and themselves by how they were raised. So that's how I use it in therapy, but it's not something that is beaten to death looking at or understanding or that sort of thing. That doesn't mean other therapists might not do that. That's not my style. And there has to be a purpose for doing that too. So I hope that that gives you some idea of what therapy isn't so that you understand what therapy is. And if you have any questions or would like more information about me or how I work, please feel free to contact me. My information is on this page. Thanks.